I thank you for your time, and I'm happy to see colleagues from around the province joining us today. My name is Winnie Lau, and I'm the Vice Chair of the BC Renal Pharmacy Services Committee, and I'm coming to you from the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh. As outlined in our invitation, we'll spend the first 15 minutes of our time going through some readily available resources that may help you in your everyday, followed by 10 minutes of Q&A session and open forum conversation. I'm joined today by other members of the core executive group of the Pharmacy Services Committee, and collectively, we hope our diversity of knowledge will allow us to give you a comprehensive answer and insight to any questions that you may have. First, we wanted to share a bit of the background behind the initiation of this webinar series. At BC Renal, we hope to engage our community pharmacy partners by use of this series as a means of knowledge translation and open dialogue with our colleagues across the province. In 2021, there was a survey that was sent out to assess educational needs from our community pharmacy colleagues, and some of you may have participated in that as well. It was abundantly clear during the survey that many felt the desire for connection, to understand how decisions were made, and therapeutics that may not be easily gleaned on a busy workday. Thus, these 15-minute snippets of information, followed by an open form of conversation, was felt to address both needs. Lastly, we recognize that not everybody will be able to attend these at this time, so they will be recorded and stored on the BC Renal YouTube channel. So first, I'd like to share this BC Renal orientation onboarding website for us all. You'll see here that we recognize that there's always going to be turnover of staff, and onboarding is something that's very critical and important. And this website was created for this purpose. It gives a high-level understanding of BC Renal and where we fit within the BC Health Authority system. You'll see here introductions, who we are, the structures, and certainly for us here today, we'll be focusing on kind of the community pharmacy aspect. So here on this website, it does highlight that BC Renal partners with over 30 community pharmacies across the province. Together, we help to provide funded formulary medications and nutritional supplements for our patients across the province. And on this partnership, we hope will help to create a clear understanding and a consistent approach for patient care. It allows for targeted communication and learning opportunities, such as this webinar today, to help support each other. On the bottom here, you'll see also a heat map for all the different community pharmacies across BC that we're in partnership with. So if you yourself are new to BC Renal, or anybody in a community pharmacy who may be new, we definitely suggest recommending this onboarding website to talk so that you may familiarize yourself with our structure, the collaboration, and certainly some of the initiatives and work that we're working towards. Now, next, one of the things that came up in that 2021 survey again and again was the desire for continuing education, and specifically continuing education as promoted by BC Renal for things that are relevant for our patients within our province and up to date for our patient population specifically. Certainly myself as a pharmacist, I need to fill in those continuing education every year on the PDAP website. And so this BC Renal YouTube website is really a great place to start off looking for some of that information. So when you first start off on the website, you'll see that it's quickly divided into various sections here. And certainly there's a section called province-wide rounds that's highlighted here. When you click into it, you'll find over 124 videos here. And province-wide rounds is a collaboration between BC Renal and the UBC Division of Nephrology. They're presented by local and international experts for a wide range of information that's up to date. They're under 1 hour long, so it's perfect if you have any downtime that you want to listen to or watch during your commute or even during your workday. You'll see here topics such as palliative care in BC, so very specific to BC and what we're doing. Even clinical topics like hypertension, renal denervation, ANCA-associated vasculitis, and so on that you can see here. Now, going back, there's also a section here about BC Kidney Day. BC Kidney Days is an annual conference where we're all gathered together to talk about topics and research that's happening around the province. The keynote presentations and some of the other presentations throughout this conference are recorded and stored here on this section so that if you thinking about going to BC Kidney Days, or maybe you went and you wanted a refresher on some of the topics you may have seen, this is a great place to look into that. As well, there are some patient-facing videos as well. There's some patient-to-patient videos and also things such as grocery shopping for your kidney diet and even things like better at home. So little information videos for patients if they're interested in any of these topics that may be relevant for them, that you can help direct them to this website as well. So the next thing is on the BC Renal website itself. There is a section that's titled Learning and Events here. And when you go into it, on the right-hand side, you'll see that BC Kidney Days that we talked about previously, and the upcoming BC Kidney Days information will be posted here. In the middle section, there is a section about patient education, which again are a lot of a great resource that you can help direct patients to. There are recorded sessions here, such that if you have patients asking about questions about transplantation, there's lots of videos here for them, even tips and strategies for finding a living donor. Dialysis, what, why, how? There's lots of videos here about it. And certainly other topics such as medications, kidney disease, food sense, and kidney health. These are all great videos and resources that you can direct your patients to if they have questions about these topics. Going back, looking at kind of pharmacist specific, continuing education, there is here on that left-hand side, clinical education and webinars. We previously highlighted a province-wide round that where past sessions are recorded and stored on the YouTube website, but certainly the upcoming sessions are all highlighted here as well. So you'll see all the upcoming ones in terms of the date, the learning objectives to be achieved. And if that's something that you're interested, there is a subscribe button that you can join the email mailing list so that you're up to date about what's happening. Going back, another really helpful session is the kidney care staff education. These are webinars, educational webinars that I created for the kidney care clinic staff. They're meant to be practical information on a wide range of topics. And here you'll see in the past sessions that it's all recorded here as well. Again, they're meant to be practical information. So a lot of it I find is really relevant to us as pharmacists. There's one here on finerenone about its current role, and even topics about guidance, new guidances for our CKD patients about diet. Again, they're all in video format, so it's easy for you to start and pause as necessary so that it's readily available and can be done at your own time for some of those CE learning opportunities. Another session in terms of learning is the CKD e-learning for primary care. It was a program that was geared for primary care clinicians. The current program is currently on a hiatus, and there's no future sessions coming up, but there is a resource in terms of past sessions. And certainly the pathophysiology for things like hypertension, CKD, and SGLT2 hasn't changed. And so these are still really relevant in terms of continuing education to learn about topics that you just want a quick refresher on. So beyond this section about learning and events, there's also one called health professionals. Again, as a pharmacist, whenever I go into these sessions, the first thing I go to is really the pharmacy and formulary section. So clicking into it, you'll first see here on the very top, there's the 4 formularies that we're all pretty familiar with in terms of dialysis and formularies for CKD patients not on dialysis, GED, etc. Going down here are a bunch of the guidelines, and these are the guidelines that really have been summarized from international guidelines, and there may be specific adjustments that may be made based on our Canadian formulary, medication availability, and what we find here for BC Renal in our province. And so these are obviously really relevant in terms of anemia, antibiotics, medications for GN and mineral bone disease, such that if you ever need a refresher, it's great for that. What I find really useful as well as from a community pharmacy in terms of like patient facing is a section called medication information for patients. When you click into it, the first thing that I give to a lot of my patients is this over-the-counter non-prescription sheet. It's available in both English, simplified Chinese, and Punjabi, just to make it available for as many patients as possible. When you click into it, the English portion, you'll see here that it is a high-level overview of non-prescription medications for your case. In here, it's the common kind of over-the-counter ailments that patients may come to your pharmacy with, such as cold and flu right now, and even things about colonoscopy preparation, especially for patients who are anticipating transplantation and having to go through that process. Within, they'll talk about medications that are okay to take, medications not to take, and the reason why. So it's really helpful from a counseling perspective to explain to patients, why we may suggest one thing over another. This PDF is really helpful in terms of keeping it at the pharmacy, whether as a counseling opportunity or even just, if you have an OTC shelf, just to have it there so that patients can readily look at it and refer to it when they're coming in looking for certain types of medication. Again, here in the bottom, there's other highlights and categories such as fever, pain medications, laxatives, etc. So going back to this resource, another thing that's really helpful for our patients is this conditions and treatment section. Within it, it's separated into a bunch of categories for things that our patients may be experiencing. Certainly right now, it's the winter time, so I'm getting a lot of patients come in talking about itchy skin. So in that section, if you expand it, there will be medications that we may commonly prescribe for this ailment. I'm sure a lot of you guys have dispensed a lot of Puree itch cream, and you'll see here within it, there'll be information sheet that each of the medications have. And certainly as our community pharmacy partners, we hope that when these medications are dispensed, that these unique medication pamphlets that are created are given out to the patients along with the medication. They're really, the purpose of them is really just to make sure that we are consistent in the messaging that we're giving our patients, as the language that's used is created in a unique way that's specific for our patient population. And that's why it's so important to hand it out when the medications are dispensed as well. They give you, quick overview when you're counseling the patients of how to take it and what to do and side effects that they may want to look out for. Within these common ailments as well, beyond the medications, there's also kind of just a common handout that can be given to the patient. So in this Managing Itchy Skin handout, they'll talk about kind of non-pharmacological things that we can do to help our patients when we're giving counseling. Things like taking lukewarm water and avoiding like hot baths and things like that. So again, these are just things that can really help our patients sometimes that are just beyond medication relief that they can have. These handouts really just help to highlight some of the things that are really helpful for our patients, and whether it be a resource that you use when a patient comes in, or just as a way to kind of like direct your patients. These are all things that are made to be very patient friendly and, patient facing as well. Lastly, another really important thing that we've created is this what to do if you're sick. Again, it's been translated into various languages for access. And this pamphlet is given at all the kidney care clinics to the patient. It's really a way to kind of educate our patients. And again, as our community pharmacy partners, it's something that you can help with as well, especially when the patient's coming in telling you about having symptoms about cold, diarrhea, or dehydration. And these handouts are given to patients to highlight that, certain medication categories and certain medications specifically may want to be stopped when they're experiencing these symptoms of dehydration and what to do when it happens. There's a section for contact phone numbers so that you can either put your community pharmacy or their kidney care clinic and their healthcare providers' phone numbers there so that they know what to do when they're experiencing those things. Um, so this is another really great resource that you can introduce to your patients. So the last thing today that we're going to kind of highlight is really just promise. Promise is another topic that comes up frequently when we were going through that survey, looking at what the needs were with our community pharmacy partners. And Promise itself is a patient records and outcome management system. And because it's not the dispensing computer system that is utilized, we understand that it may not be something that you use, on a day to day. But it really is something that, as a community pharmacy partners, it's a really great resource that you can use. There here is a test patient just to like show you what it would look like. And inside, when you do utilize it, it'll give you trends for labs for the patients, which is gathered through both outpatient labs and hospital labs. You can see on a trend basis how patients' renal function or other particular parameters are doing. It'll have records of physical exams so that if they were at the kidney care clinics or any other clinics, what their blood pressures and their weights have been going, and certainly a record of their medications as well would be here. And so this is a great tool such that, when patients are asking you questions about how their kidney disease are doing or certain medications that you're kind of concerned about their renal function, this is a great place to look at for some of that lab specific or kind of how they're doing in terms of their medical status. Now, because as mentioned, we totally recognize that it's not something that's readily used on a day-to-day. There is a section here for training and support, and there's help desk support. You'll see here when you click into it that there are toll-free numbers or phone number within the law mainland, and even after hours support if there are urgent requests, such that if you need help to get into Promise to look into information, or if your pharmacy group wants to look into doing a refresher once a year about how to use Promise or high level where we can access certain information, this would be a great place to start that conversation via email. And then certainly in that training and support column, there is a section about training itself. There are online modules here in this website highlighted, and there's also a Promise user guide, which again will be quick resources if there's just like quick things that you're trying to look up and to refresh yourself about how to use Promise when you're looking for a specific answer. So today, I've really kind of on a very wide overview, kind of gone through a couple of different tools, resources, and just places that hopefully, giving you some new resources that you can utilize in your day to day. And now we will highlight the section where we'll open the floor for open dialogue and conversation so that we can talk about anything that may be relevant that we can help answer at this time for you all.